with yourself. Yeah, and I'm trying to also send it to my thank you all so much for coming. Good afternoon, good morning, good evening from all over. I see I see Ghana in the house. I see Canada in the house. UK was in the house, but I'm sure they'll be joining us soon. And I'm trying to make sure we get it connected to Facebook Live. By all means, feel free to share it on your Facebook pages and the different platforms that you have. Welcome, welcome, every one of you. Thank you, thank you. So grateful you're here to join us in our, I can't remember, this is the fifth or sixth we are in the series that we are doing. And as you all know, I believe everybody knows him, but I know people are coming because of Anne-Marie and some people are coming because of Clarence. And so if you don't know me, my name is Marian Amwa, and I'm a coach, I'm an author, I'm a friend, and I have many other identities. But thank you so much for joining us today. Our conversation, as you all know, is based on breaking through the Immigrant's Handbook for Thriving in the American Workplace. And we have said that the principles, the stories really cut across different immigrants from different countries and for different workplaces, whether in the UK, whether in Australia, wherever. We have seen lots of similarities. Even the stories that we have shared, we've heard people say that, oh, I have very similar stories. So we will continue our conversation. It's very informal. If you have any questions, please put it in the chat or you can raise your hand. And please, we are recording. So just to let you know, so that those who are not able to join us today can listen to it. I mean, at this time, can listen to it at a different time. But I am so honored to have here. Last week, I said they were special. This week, to their special. Next week, to their special. I have two very special people in our midst today. We have Dr. Anne-Marie Wedu, who, as your the flyer says, she's a radiologist and she's based in Phoenix, Arizona. And then we have Dr. Clarence Sarkodie-Edu, who is a hematologist, oncologist, also based out in Phoenix, Arizona. That is why today we are having it at 11. And so for the next 1 hour or so, they will share their stories, share their experiences, and also provide us with some tools. I'm sure some of the stories might be entertaining, some might be inspiring, for us to, learn from each other, and also those behind us and those who are also trying to change careers. So we don't really practice, so I don't know how the conversation is going to go. But one thing I know is that by the time you leave, you'll be entertained a little bit, you'll be empowered, and you get some resources for yourself or for other people. So Annie or Anne-Marie, Dr. Anne-Marie first, can you just introduce yourself quickly? Just touch some key points that you want people to know about you. And Clarence, when Annie is done, the same applies to you. Oh, I think, Annie, you need to unmute yourself.
So my name is Anne-Marie Wedu Annie. I trained at the University of Ghana Medical School. I graduated in 1992, and then I did my housemanship there. And then that was required of all of us. You have to do it to be able to, I think it's part of the requirement to be able to do anything else outside or anywhere else. And then I did a 3-year hiatus in Japan. And then I migrated to the US in 1990. So, well, I finished in 94 and then I stayed in Japan. I came to the US in 1997. So I've been here since then. And I did my internship. I did a radiology residency, which is 5 years. So I did a required internship or preliminary year, which is called postgraduate year 1 in general surgery in Michigan at in the Michigan State University in Kalamazoo, Michigan. And then I moved to Rochester, New York to do the additional 4 years of radiology residency. And then I took my board exams there in June 2020. 2004. And then my family had to migrate to Arizona, so I moved there and took a year off to take care of my family. And then I joined, because then I had to apply. First, I was going to do a fellowship in Rochester, but then because we had to move, I had to come there and apply. So then I started my fellowship, a 1-year fellowship in body imaging in 2005. And then I continued on in 2006 at the University of Arizona. And so that's my training basically. And I was there till 2013 when I went into private practice, and now I'm at the VA hospital in Tucson, Arizona.
Okay, we'll come to that. So Ghana trained, Japan, and then in the US. Very good. Thank you, Annie. Dr. Clarence.
Thank you. Thanks for having me on, and nice to see you and everyone. So my medical school training was in Ghana, the University of Ghana Medical School. I completed in 1990, did a housemanship for a year, and then I joined the Department of Medicine, intending to train in internal medicine, but I cut that short to move here. So I came here to the St. Agnes Hospital in Baltimore, did my residency there, served the chief residency year, and then I did a fellowship in hematology and oncology at the University of Maryland. I stayed on there for 5 years, teaching on the faculty, and then after that I moved down here to Arizona, and I've had one more job change since then. So in my current job, it's a private practice that I share with several other doctors in the same specialty. I live here in North Phoenix with my wife. Our 2 children have left home. So I live here with my wife, and we have an old dog, Oscar, and that's what makes up my household. In terms of what I do with most of my time, I have a couple of hobbies that I pursue. Maybe I might have time to share some of them. So that's, in a nutshell, what I do.
Great, 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 great. So you have Oscar. I have met Oscar, but thank you both. And once again, welcome everyone who has joined. Thank you, thank you, thank you, thank you. What we do is we have a set of questions that we go through, and we piggyback as needed. Now, if you have a question for either Dr. Clarence or Dr. Anne-Marie, please feel free to put it in the chat. My mentee, Farah, is here. She would read out the questions for us. Okay, so the first question, in the book, I talk about culture shock, right? I have my own experiences. I have my own experiences. I was really surprised, having lived a little bit in Spain for my year abroad. When I came first to Baltimore County, I was shocked that there were no buses. Like, I was like, why are the roads so big? Why are there no buses? And then one story I talk about in the book is when I was a teaching assistant, a graduate teaching assistant. When I went to class teaching French, people brought their pizzas in the class. They were eating pizzas, had coffee, and that was unheard of, but I had to adjust. Anyway, we are talking about you today. Can you describe any experiences or feelings when you migrated to the US? And you can talk about Ghana, Japan, and here, any feelings, experiences when you migrated here, having trained in Ghana. If you can give us some, the things that surprised you, that, gave you a little bit of a shock. You can talk about language barrier, culture shock, any significant adjustments that you had to make. This time, let's start with Dr. Clarence.
So in my first few years in Baltimore, I was working in Baltimore, and in our field, the initial years of residency are very busy. It's not, in my case, I spent maybe between 10 and 12 hours a day in the hospital, just working. And every 4th night, you stayed overnight and then continued into the next day. So my cultural experiences were not very much those outside the hospital. I hardly had any time or anything to do outside the hospital. But within the hospital, there were some things that surprised me. I'm not sure that they shocked me per se, but they surprised me. The way, for example, the hierarchies here, the fact that we didn't necessarily have the same hierarchies as in Ghana. In my profession, for example, the roles of different persons, what the doctor does, what the nurse does, what the patient can do, what questions the patient can ask, what things the patient is entitled to, one's responsibility to them, and so on. I have to say, I had heard about many of these things because as a part of the examinations to come to the US, you have to take a course in US culture and so on. So I knew about all of these things, and perhaps that's why they didn't shock me too much. But a lot of things were very different. And the way you show respect to people, the lack of respect based entirely on age, for example, or status, which was very different from what I had been used to in Ghana.
Can you elaborate a little bit on the respect? Because respect is one of the topics in the book, where growing up as a Ghanaian, you couldn't really argue with an adult. Adults were always right. Even as a patient, when you went to the hospital, what the doctor said was final. You couldn't, So can you elaborate a little bit on the respect?
Yeah, some of it was respect for elders. That in Accra, where I had lived most of my life until then, there was a certain given expectation of respect for elders. One expected not to speak back to older people and so on. And in our work, it translated also to not just those who were chronologically older, not just that people were older, but a certain respect for those who were higher up in the profession. So if you were a student and a professor said something, you didn't challenge it, and you didn't make a contrary view, and so on. So that was one thing that I found very different here, in that even though in starting I was very low on the poll that way, I was still expected to share my view, say my points, and as I rose in the profession, I was also in turn expected to listen to others, even if they were professionally or academically my junior. That was very shocking.
So would you say, was it good or bad? That was shocking. So did it shock you sometimes shocks are good as a doctor, as you know. Was it a shock in a good way?
I welcomed it because I come from a family of 7 children and I'm the youngest of the 7. So in my house, if I didn't protest, I was cheated. If they brought a cake at Christmas time, if I didn't speak up, I wouldn't get any. So I was very outspoken, and I was always one, even in Ghana, that I bucked that system in Ghana. So for me, it was actually a very welcome thing that, hey, here, I was finally in a land where the younger people can speak up and can say what they want. And even in my program, I got into trouble a couple of times because I overdid it, sometimes challenging some of the structures or some of the seniority structures that did exist. The important thing is it's not that hierarchy doesn't exist here. It does, but it's based on other things. It's not based necessarily on age. Your program director could easily be your own age, or your supervisor could be younger than you. So those respect lines still exist, but they are not based on the same things as they were based in Ghana. And once I recognized them, you try to respect what it is. One thing that I guess I think I'm still learning was that in Ghana, when we spoke among peers, we interrupted each other quite a bit. I was never one to want to wait for somebody to finish talking before I would start my conversation. We spoke over each other. If even today, if you watch interviews in Ghana and so on, you see that quite a bit. And that was something I had to learn. So that had nothing to do with seniority per se, but it was still a cultural difference that very often here, if you interrupted somebody, they would stop, but then they would chalk it down as you're being rude or you're being uncouth. And in the same way, if I was speaking here, I had to be very careful to notice the cues that people made when it was their turn to speak.
Okay, great. So you've raised quite a number of points. I like the respect piece and how you've explained it. Now let me jump. Annie, we'll come to you. So if you were advising a younger student, somebody who's come for an exchange program or med student who has come here to start their career, how would you help them? What is the advice you'd give to them to navigate this respect thing? Because some folks are never able to adjust, and that goes against them because you don't hear their voice. Even when I was teaching, like people from some countries will never raise their hand to participate, and participation was always like 15% of the grading system, 15-20% of the grading system. So what is the advice you'd want to give them? Because this cuts across different professions, different spheres, like everyday life, actually.
I would say learn the culture, be aware of what the norms and the mores are here. Learn what is acceptable and what's not acceptable. For example, in Baltimore, where I started, you couldn't interrupt people if they were speaking. It wasn't done. But then on the other hand, people would stop speaking at short intervals so that someone else could speak. And then I moved to the West Coast here in Arizona, and things were very different. So in Baltimore, for example, I realized there was no such thing as speaking in turn by seniority. I could speak first. My program director might speak second. And if he said something, I could contradict him. In fact, I got to be well known for speaking up because a lot of my colleagues wouldn't. But it ended up helping me because when they got to trying to elect, for example, a chief resident, he was happy that I got elected because I would speak up. When I moved here to Arizona, it was completely different. In Arizona, if we were, for example, at a tumor board, which is the discussion that oncologists have about how to treat patients, if the tumor board was always started by the most senior person in the room, the program director or the most senior, the most accomplished person, and they spoke in turn. And if somebody higher up said something, they didn't expect the so-called junior doctors to contradict it. And it was very different. Even the seating arrangement at conferences was very different. In Baltimore, when we went to a tumor board, excuse me, or similar conference, you sat where you liked. When I moved here in Arizona, I soon learned that the head of the table was always occupied by the person running that conference. And that was the person who started it and ended it. And people sat according to certain general specific things. So it's not the same throughout the United States. It's very different everywhere. And it's not even the same from one institution to another, or one town to another, or one profession to another. So you asked me what I would advise. I would say quickly learn the mores that pertain to where you are. you don't need to buck that system, but it doesn't mean that you need to be afraid of the system either, because within it, you have to find a way to express yourself, make your opinions heard, make your preferences heard. No one will speak up for you unless you do. So you have to find some way to express what you want. And at the same time, you have to find some way to listen to others as they express theirs. And I think that's what I would say.
Wow. Okay. So learn the culture. And then you make a very important point that cultures differ from place to place, West Coast, East Coast. So learn the culture. Thank you. And then no one will speak up for you unless you speak up for yourself. And listen. I hope you are getting some serious nuggets here. So Anne-Marie, sorry, I call her Annie, but Anne-Marie, same question to you, your experiences, feelings, culture shock. You can add to what Clarence has said, or, take it whichever way, your own experience. Yeah. So please.
I'll try and say this, try and summarize it, but I'm just trying to see how I can say less, but less would be more. So as I said, I had to do a stepped transition to the US. So I was in Japan, where the culture was different as well. This is Japan. This is an Asian culture where some things are similar to Ghana in that this kind of differential attitude or posture that we should have is quite like Ghana in some ways, that there is some differential, you are differential to the aged or people older than you. So that was there. And also the way they have the whole thing that you don't give something to someone with your left hand. They also have that whole thing. So those things were there, and your professor was the boss, and you addressed everyone with a title, just like I had in Ghana. But I think it was even a little too polite, maybe very polite on that side, more polite than Ghana. So when I moved here, I remember, this is just an example, but I remember calling someone. Maybe I'd been there 3 years and I'd forgotten a bit. I just called someone in Michigan where I was, and I said, I wanted someone to do my hair. So I remember saying, hi, my name is this, do you do hair? And her response was, do we what hair? And for me, having been 3 years in Japan, if I'd come straight from Ghana, I'm sure I wouldn't have been that shocked. But just to tell you that for some reason I had been affected or influenced by the very polite environment in Japan, that I thought she was being rude. Now I wouldn't think so, but she really was asking a question that specified, what do we do? What do you want us to do to your hair? But I still remember that to now. But fast forward, so I was 1 year out. Well, is it 2 years out? Well, I started yes, 2 years before I started my residency. And let me just give you a picture of what happened. Like this was a language barrier. And I've spoken English throughout my life. Right? This is what happened. I was my first, maybe the first trauma that we had, and we're doing surgery. So I had the trauma pager. So they paid you in the night. And then people from different disciplines come together to the trauma bay. And then someone tells you what is the history, what is going to happen, who is on the way. So the emergency staff is bringing someone who has had a trauma. But we are all, surgery is coming, whatever, orthopedics is coming, depending on who we need, anesthesiology, emergency medicine, they're all coming together, because this is what they think people, which specialties need to be there. So I was a resident Worthington, and I went down. And so someone had written the history, the short summary of the history of who was coming on the board, the chalk whiteboard, so we could see. And what they had written was horse-drawn Amish buggy, T-boned semi. And this is me, I've done English my whole life, so to me, I just gave this an example.
Can you say that again?
Horse-drawn Amish buggy, T-boned semi. See, I still remember it because I looked at it several times. And I said, I know English, but I don't know this. And this is to give you an example of what the language barrier was. Like some of the terminologies were so different. I knew horse-drawn and I knew Amish. I knew Amish only because, like Clarence said, we did an exam to help us to assimilate into the culture. So I knew that there was an Amish group of people here. So I knew about Amish. I didn't know buggy, I didn't know T-boned, I didn't know semi. right? So then it's became like, where's the verb? Horse drawn, maybe drawn. Okay. So then maybe let me, so eventually I decided that let me interpret it now to you. So I never knew what was going on until I just had to follow in a subtle way. Okay. But this is, if you had said a horse-drawn carriage had a side impact collision with an articulator, I would have had that, I would have got that. That's what they were trying to tell me. You see, we call it an articulator. I think the British call it an articulated lorry. Ghana, we call it an articulator. Here they call it a semi. And a T-bone is when the car hits it on the side. You know, we say that cycle. Yes. And then the buggy is the carriage that and you see, so I'm just trying to say this is what some of us had to navigate in terms of this. When it's a lot of English was the same, but it's the same language, but it's different. So you have to do that. And one thing Clarence said, which is very true, is that you learn the culture. And I think that I've learned that you always assume you don't know. Assume you don't know the culture. Don't assume that everything is the same as yours. So when someone says something, don't just go with it, just listen. And one thing I learned also is that try to find out what has a positive effect on people and use that in your favor. Try to find out what you do that makes people respond positively, and then use that in your favor. Because you don't know, you can't tell. And that, I think, for me, is specific to learning the culture. If I start talking and I realize that someone has a look on their face or reaction, I realize that, no, maybe they're saying I'm talking over them. That's how I learned that talking over people is not good. Okay, I also learned later on that, like Clarence said, it varies with institutions, cultures, it varies with teams, and it varies with like which part of the country you are in.
That's mutual.
I've learned recently that even there's something called the pause. And the pause is that when people are talking, especially like places like the East Coast, New York, for example, is very different from the pause in California. You know, there's a lag between two people talking that everyone is comfortable with. When places like New York, it's a shorter pause. You should be aware of all these things. It's not as difficult as we think if we just listen to people, you know, and we pay attention and not assume that we know. And so that's one, just to summarize what Clarence was saying, that's what I'm just adding to that. I learned that it's not that difficult to learn these things. For example, as I moved to Arizona, and I think the culture was easier on me than it was in, I think it really, I went from bad to better, like, you know, it got better. So I think that I'm thankful that it went that way from Michigan to Rochester, New York to Tucson, Arizona. It went that way in a better form. And the culture was easier. When I got to Tucson and I was working as a fellow where I did my fellowship, and people were saying, people would come and say, are you always glued to this chair? And they would make comments like that. You know, then someone once said, you are not like us Southwest weenies. That was that was the only comment that made me know that there was a cultural difference here. They don't take that serious. I'm not going to take that, but they work in a different way. They don't have to be seen to be working that hard. But that was what I had grown up with or learned in Rochester. So I learned that there was a difference, and maybe it was even the institution. No, it was not necessarily, although it was a university or the program, for sure was different from where I had been. And so that was one thing. Another thing that Clarence said that was true was that when I did two different things, I did the clinical and then I did radiology. And I learned that in the clinical setting, general surgery, you had to be differential to your senior. They signed off on your notes, the the chief resident. And so people sort of, let me put this, sucked up to him. We tried to impress him, tried to be nice to him, help him to do this. And so I learned that they were trying to be nice to him because he was the chief resident. So he was, like Clarence said, he could be younger than you, but he's a chief resident. In radiology, it wasn't like that. It was your attending who read you, who signed you off. So you didn't have a senior. I remember talking to some foreigners who were doing internal medicine when I was doing general surgery. They were telling my senior. But I realized when I moved to radiology, we didn't have anything like that. You know, it stopped with you and your attending. So it was a bit different, but you had to learn that as well. But one thing I also learned in spite of that, once someone did something and someone said, who did you piss off? You know, so I realized that I don't want to say it this way, but people don't forgive. You know, people don't forget, let's put it that way. And so people seem to remember what you've done for them and they do it for you. And people seem to remember what you did that made them feel. And had a negative effect on them, and it may not go well for you. So that seems to be another principle I learned.
Wow. Okay. Oh, wow. Assume you don't know and learn the culture. And that is not that difficult. So I hear that awareness, self-awareness, awareness of the culture is very important. Listening, both of you have made that point. And then of course you've said it isn't that difficult. It's not impossible. I think what you're saying is that you can do it, we can all do it. There's something that you said that ask yourself or find out what you do that makes people respond. Can you give an example?
Respond positively. Like, let's say, I remember once, well, I noticed, for example, when I came here, there was one, he was much older. He's who was an interventional radiologist, maybe at least 15 years or more older than me. And because I started late, so I was maybe early 40s or late 30s, and he was probably over 60 for sure. And so people are afraid of him. But I remember once I called him, let's call him Smith. Okay, Dr. Smith. Because people didn't say that, but I think he liked that he was from old school. People called people by first names, and people didn't like him. But I remember saying something to him, I don't remember whether how are you or whatever. And I realized that he was being nice to me. And I remember once I just said, I need help. I saw him, I need help. And I wanted to help with something to do with the schedule, because he did the schedule, and I needed some time off or something. I remember that the way I said it, I learned that I should be using this line more often, because he sat down. There was a gurney there, he sat down, and then he said, what do you need? What do you want? And so it's little things like the body language, whatever statements you have and whatever. And then another thing I learned, which was maybe mixed in this, is that this is for us Black females, right? I had my cornrow. Every time I was there, I did cornrow, and I did from New York. I was doing that. It was convenient. Then once I had to go to a wedding, and I did. But one thing I should just tell you for sure is that the environment this is West Coast. Radiology is a predominantly male residency, predominantly white male.
White male.
So there were females there, a fewer females who were white, a few Asians, but for sure I was the only Black female resident throughout the time I was there. So this is a 4-year, but once I was a fellow there. Well, when I was in New York, there was one female Black woman, but when I moved here, it was, so getting to the Southwest was West, there were no females, right? There were no Black people, there was no Black resident whilst I was there. Throughout the 8 years I was in the University of Arizona, there was no Black residents. Okay, so just to give you a picture. So I did, one day I had to go for an event, a wedding or something. This was my 2nd year there. And I did something, I did a weave on. I hadn't even done a weave. And I came back, everyone said, oh, you look nice. Oh, you look good. And this was not in a way that was negative. We know what is negative, what is no. It was more like, it was code for, this is what we want you to look like. So you pay attention, you see that, so this is what they mean. And I'm not saying that one should keep their head down and in a negative way, but I still believe in doing what works for you. So long as it's not going to kill it for other people coming behind you. We all want to be trailblazers, want to speak up for something, but know when you have gained enough favor to have a voice before you can speak. So that's another thing I learned.
Yeah. I think you said a lot. Know the culture and know what works, right? And take advantage. Work that which works. Okay, very good. I don't know, Farah, are there any questions? Does anyone have a question before we go to the next question? Farah, are there any questions? You can unmute yourself.
Let me read. Let me check.
Comments.
Yeah, we have a question. Somebody says, do you have any advice on the approach to take when speaking up so that one can be candid and honest without being branded as the angry Black man or woman?
I think I can try to speak to that, because I have been branded as the angry Black man, the angry young Black man. But interestingly, it's had some positive turns and it's had some negative turns. So one has to be mindful. And I think this is true. Again, we're talking about moving to the United States, but this is the same everywhere. So I grew up in Accra. I grew up in a, what I thought was a modern home in Accra. I could say anything I wanted to my older brother. So, I mean, I couldn't insult them, but I could say what I liked in my house and I felt free and so on. And then you move, throughout my life. For example, my secondary school, we had a certain set of things. And then I moved for university education to Commonwealth Hall. And in Commonwealth Hall in Legon, there was a different culture. So little things like, do you greet somebody you don't know? Do you say hello to everybody? Who says hello first? Who speaks first? Just a couple or 3 years ago, I happened to be in Kumasi and happened to have the opportunity to speak to, my wife is related to royalty, and I happened to speak in front of a very high up Queen Mother. And I was sitting down speaking because that's how we do it in Accra. In Accra, I don't stand up to talk to my brother or even my parents. And suddenly everybody said, stand up, put your hands behind you. And I didn't know that that was the culture there. So there are little things like that. Who can you speak to? When can you interrupt? And I think to the specific question of speaking up, if there's something negative to share, if there's an alternative view and so on, I think most leaders prefer that you share it with them in private. So it's not only how you say it, but where you say it and so on. So you kind of think for the person, if there's something they are doing wrong or something like that, I think most people will have an opportunity for you to say it to them in private. So the escalation of things goes not only from how you say it, but also where you say it and when you say it and how often you say it and to whom you say it. It's most important, I think, I try to say things to the person who has the opportunity to respond or to change it. It's not very good to go and speak to my boss about something that my chief resident is doing. No, I'll go to my chief resident and say it. And so sometimes you go with somebody because you want a witness or you want somebody to be there. Sometimes you say something in writing, sometimes you don't, sometimes you say it at work, sometimes you wait until you wait until the person invites you or you invite them to a cookout or something like that. That's when you might say something. So it's just the same things. And just very briefly, so the term education, we've tended to think it means schooling, getting your qualifications and your degrees. But many people have said that education is simply the way to take somebody, a child in a particular society, and bring them up to become a responsible adult where they can earn their own living and where they can fit into the customs and morals of that society. And those things differ from place to place. And so as we talk about getting educated formally, it's also important to be learning some of these things, and they vary from everywhere. I mean, in Baltimore, where I had started, if you met anybody, you said hello. If you didn't say hello, it was kind of, you came across as a rude person who doesn't greet anyone. You came to Arizona, and even somebody you knew, like a neighbor, if you saw them somewhere and you said hello to them, it was as if you had slapped them or insulted their mother. They just didn't expect to be greeted. And those things vary. And there's nothing I think we can say in a 1-hour discussion that will give all the examples or all the situations. And I'm sure everybody has their own examples of these. But all I would say is, I mean, just look and learn. And we don't necessarily want to blend in, but we do want to fit in.
Okay, great. We will come to Abigail next, but Annie and Marie, do you have anything to briefly add to what Clarence has said? Angry Black man, angry Black woman.
Yeah, I think sometimes I even think it's worse for us women, because I mean, sometimes I just sense that, I mean, I've met people who from the get-go, they saw me and they look nervous. I mean, white men, because I think it's, you know, we confrontational Black woman. So I could get that question. And because of that, I think that in my mind, when I've seen that body language, especially, that is how they see me, even to start with, before I even say anything, I try to put them at ease. I'm extra nice to them. I play nice, you know, and I think that's worked for me. I do what they, and for some reason, the bar is not that high because they don't expect much from me because I'm a Black woman. I mean, so it's depending on what it is, it's saying hi when you come, when you have eye contact, or I mean, if you're working together and close enough, you get into their life a bit. I mean, how's your day been? You know, you start like that, and a few comments, or you always wait to see what response or what he said that had a good effect. And for me, it's always worked that way. And so a lot of people are easy to deal with that way. Like Clarence said, go and see them privately. I remember one occasion where I wasn't sure. Should I say something? There's this going on. I'm not sure. What should I speak up? And I had to do some research. I had to find out from other people. I want to say this. What do? I had to find out before. I think it ended up being maybe going to see them in their office or something, but I didn't just do it. I had to think about how to do it. So that's what I can add to it.
Yeah, thank you. Abigail, we'll come to you. Let me just say that if you are a manager of this, you know, joining us today, or you lead a team, it's also incumbent on us to ensure that people can bring their best selves. There's something that we train on at work. It's called psychological safety, where there are steps: inclusion safety, learner safety, contributor safety, challenger safety. As a team, when you're managing your team, if your team members have that challenger safety where they can speak their minds respectfully without being punished for speaking their mind, or where they can challenge the status quo, I think that as managers, we need to create that environment for people to be able to speak up. Abigail, please go ahead.
Thank you very much. I will not be on camera just so that the limelight is on our speakers. But I had an earlier point that in the chat that was missed. Thank you so much, both Annie and Clarence, for this talk. But Annie, you made a very important point when you were introducing yourself, that as an immigrant woman, I don't want us to lose sight of. You mentioned that at some point you had to put your career on hold, move to take care of family. That just triggered a thought in me, because there's so many professional immigrant women. By the way, greetings from Canada. I should have said that earlier. There are so many professional immigrant women who have had to put their careers on hold. And some of them have put their careers on hold for good. Can you share any insights on how you navigated your specific situation, and any advice that others can, hone in?
Sure, yeah. And I'll start by saying everyone's situation is different, and I wouldn't want anyone to use my situation or my example. It depends on what they are looking for. For some, it's a choice, and I think it's a wise choice, because I always say that we women, we just try so hard. Sometimes I joke that someone will ask a woman who is a professional and also has a family, so how do you do it? And my response is, we don't. It's a trade-off somewhere or the other. So some people decide not to do it. But I would say if you like to do it and you have the support at home, for sure you need the support at home. It helps a lot. And then I would say it depends. You work with the situation. Quickly, what happened was it's true, I finished in 1994. Actually, I even was a 1992 graduate from the University of Ghana Medical School. But after we had to do 2 rotations before we finished a house of 6 months each. After my first 6 months, I had to leave and go to Japan and come back because I just gotten married. So I took a break. So now I was 2 years behind. I joined that year, 1 year behind. I joined that year of second residents coming in to do my second rotation. And then after that, so now I finished in 94. And then I went to Japan, and there I couldn't do much for clinical work, I just got to do some attachment as a wife, you know. And so again, it was a hiatus. So I just took advantage of that and did the USMLE exams, United States Medical Licensing exam there. So for me, it was a longer thing, process. And so then I started a family. And so moving here, when I came here, I was at home and it was still a challenge. I'm just trying to say everyone's situation is different. I'm only telling my story as I go along. But I remember not even having, even just applying for the thing with having 2 children and all that. I remember going to look for a residency and I had the second child in a car seat. When I was going to look for my second, you know, we had to get 2 residencies at once for radiology because you need your preliminary year and you need this one, radiology. So you have to get both, you have to match into both of them at the same time. And I didn't get one. So I was going around with my child in the car seats, you know, so you get the idea. And so I had to do that. Well, fast forward, eventually when I got in, then I had to learn because you are studying for radiology, you have to do 3 sets of board exams and pass all of them during your residency. You know, for sure, there were eyes on me because I'm trying to say in a negative way, because can she do it? Because I was the only one there who had a family, who was a woman. And that whole race. So people were commenting like, I remember once someone asked someone that, does she always come late? Even before I'd been late. You know, you have those things going on. And then I remember I had one mentor, Nigerian man. First thing he said to me, have you seen any Black person here? I don't want to hear you say your children have coughed. So he gave me an idea of what the environment was, you know. So that helped. That helped me. So if my child was sick, I didn't say it. I had to find a way around and quickly give him some Tylenol and put him in daycare or something. I mean, it was, Abigail, we had to do it, but it was not easy. And between the 2 of us both doing residency, he was 2 years ahead of me, my husband. We had to just play tag, and then also we didn't take time off at the same time so that we could take care of the children. So we had to do that thing with childcare as well. Only knowing the good things that you know that the training, that's Abigail, that's maybe the answer specific questions. Answer is that the training has a finite end. So that helps. So you know that it's not going to go on forever. You know you're doing it towards something. And so you do it for that reason. So you have a goal that you're going to do this so that you can get a better future for the family. So what happened was when I finished and I took a year off, I didn't even know whether to do fellowship because I'd done 5 years of residency. And then someone told me somewhere, I asked around, they said, no, if you do that, you can call your shots better. And that's what I was looking for, time management. Because my children had not done any of those things like Girl Scouts, no. So I remember when I did the fellowship, during the fellowship, I was offered a job as an attending whilst I was doing it. For some reason, I found favor with my chairman. He called me and gave me a job. And I remember having that conversation with him and saying, thank you for giving me the job, but I will not be full-time. I had already decided, you know. And so he said, oh, do you want to do 80%? I said, no, 60%. So I started with 60 before I changed it to 80%. But I'm saying that I was looking for opportunities to have a good, so that I'll be able to do all those things you do for them, like, you know, what a Boy Scouts, Kumon, gymnastics, all those things that people do, I had never done, you know. So, you know, you have a plan that you're going to do for some time so that you can have a better life, then you do that. So I don't know whether that answers your question.
Yeah.
Yes, thank you. Thank you very much.
So there's that balancing act. Thank you, Abigail, for the question. I know there are probably some more questions. And that reminds me of something that the last session, Gerald, who is here, talked about resilience, that the background that, you know, the things that we went through as children, you know, one textbook for how many kids in the class created in us some resilience, which helps us to adapt and make it here. But having said that, let's, based on that question, can you I'm just hearing some of the unique challenges that immigrants face, because I'm sure if you're in Ghana, you had children and you're doing the residency, you have a family member or a mother and you know, somebody who can support. So the question that I had was, you know, what are some of the unique challenges that immigrants face when pursuing careers in the healthcare industry? And I think that this is not just the healthcare industry. It cuts across different industries. So how do you overcome them? You gave an example. Maybe Clarence can also give an example, you know, some of the challenges people face. as they migrate here to healthcare industry or some other professions that they might want to be in?
In terms of global career changes, I very much I very much identify with what the last two speakers have just said, because it makes a lot of sense. I think it's perhaps more important with women. It may not be unique to women, because many men also have to have similar or similar changes. And again, it varies with everybody. I mean, everybody's family structure is different. Everybody's financial situation is different. Some people may have other family members that can help and so on. For me, the biggest decision I think I've had to make was at some point having to decide between academic achievement versus quality of life. And by academic achievement, I mean, there was a time in my career when I could have spent more time at work, done more research, published more information, and achieved higher academic merit, academic and teaching merit. At the same time, one gets pulled by children are beginning to grow up. They need the parents in their home. It's not enough to just leave everything to one parent. Sometimes you need both parents, and you need to begin to earn a little bit more money because now the children need braces, or they need to go, they need to travel for Girl Scouts or that kind of thing. So those challenges happen a lot, and I very much value and appreciate what was just shared by Abby and by Annie. So, just to mention that they happen throughout and to everybody, and it's important that we recognize those choices and those decisions. They are different for immigrants than for locals. Looking at money, for example, many locals, for example, in my profession have school loans to pay, but at the same time, they have very heavy inheritances to expect from their parents, which they can use while here. The converse is true for us. I did not have school loans to pay, but anything that my parents would leave to me are in a country that is 2,000 miles away, and it's difficult to even take hold of it, and so on. So there are all those things that are cultural differences. I'm not sure that there's enough time to go into them, but I think everybody has some of those challenges and should pay attention to how to navigate them.
Yeah. So I wrote down the balancing act, and welcome everyone, those who just joined. We are having a book talk on breaking through the Immigrant Handbook for Thriving in the American Workplace. It's interesting how the conversation has gone today. We've had, balancing, looking at your lifestyle and selecting or making the wise choices that will be good for you, your quality of life, your family's life. So thank you all. Farah, the time is never enough. Farah, are there any questions? And then I think I'll go to the last question. Farah, are there any questions or comments?
Currently, we don't have any questions, but we do have some comments.
Okay, can you read one or two comments before we go to about the last question?
Sure. In our conversation about the angry Black man, angry Black woman, we have Miss Geraldine saying, be less direct and more conversational. Miss Sheila, I prefer to show them otherwise if that's what they're used to. Play nice, make it personal. Also talked about your tone when you're speaking. Be mindful of facial expressions when speaking, for Miss Geraldine.
Okay. Great. Thank you. I saw it. I think Geraldine's comment popped up. Facial expression. Be mindful of your facial expression. Very much. Okay, so Dr. Anne-Marie, Dr. Clarence, we are almost coming to the end Clarence, I told you, let's do 2 hours. You said, let's do 1 hour. And time is now, I'm not even sure which question to look at. Okay. Looking back, what's one piece of advice? We'll do 2 more questions. Looking back, what's one piece of advice you wish you had received when you were starting your career here in healthcare as an immigrant? The one, if you were to speak to your younger self and to the people here gathered. And then let me give you the second. Okay, let's do this one and then we'll do the other question. So if you can answer this briefly.
I think the thing, and in my case, I would have liked that advice at the beginning of not even just my career here, but even for what I started in Ghana. It would have been to learn people's names and learn a little bit about them and to remember it and even go back and maintain those relationships I had, even if I moved on to another location or another department or something like that. I think the thing that I have lost the most throughout time is, for example, I had some very good friends in Ghana when I was in Commonwealth Hall, but I knew all of them only by their nicknames, and I never learned what their proper names were or where they went back home to after school had closed. So fast forward 10 years later, and it's time to keep reestablishing those friendships. And this is from before there was Facebook or anything like that. And now I don't even know where anyone is and no one knows where I am. In the same way, when I moved on from my residency to my fellowship, I neglected to go back and visit from time to time with the people that I knew there. I never went back to say hello to my program director or the people, the relationships I had established. And over time, I lost those relationships. And I wish that I had learned earlier on how to do it. So
Yeah.
I would say it's important, learn who people are. They are not just persons in the workplace. Everybody has their own life story. And I think it's important, not just for one's own advancement, but also because you might have an opportunity to help someone.
Okay, great.
If I might just say one quick thing about the angry young man, the angry young black man thing.
Yes.
In my department, it happens. And I think sometimes it's correct. Sometimes I am angry and I'm not so young, but I am angry and I'm a black man. And there are times when it's important to speak up and ruffle feathers a little bit. So I'm not trying to say that you always have to blend in. And that's why I say it's important to fit in, but I don't think it's necessary to blend in. There are times when one needs to speak up, and sometimes you do ruffle feathers.
Angry black man, angry black woman. Annie, same question, and then we'll have one last question. But
okay, so let me see what I can. So, well, for me personally, let me say it that way. I only found, so we have United States medical licensing exam. It's in step 1, step 2, and step 3. And I took step 1 and step 2 before getting into residency. That's what most people do. That's what it's required. I didn't take step 3 because I was in New York. And then, so I waited. They say you don't have to take it because I didn't need it for my residency. I regret not having taken it earlier than I did. That was because I didn't have the information. I took it after my residency. I took that year off, like I said, and then I did it. And it was a good time to do it for this. But then later on, when I got into private practice and I was looking, because of that, I was hesitant to get into private practice. And quickly, it's because in radiology, when you get in there, you're doing something like, if you do teleradiology, you're going to be licensed in many states. And then you go through each state's requirements and you realize that some of them require a smaller gap in time between 2 and 3. So that's to give an example, like I didn't have information. And so I think that one advice I'll give is that look for the information. And I'm probably speaking, even if it's in the physician field, I'm probably speaking to maybe 3 sets of people. One is the immigrants who came here after medical school and a foreign medical graduate, someone who graduated from a foreign medical school and is here. Another one may be someone who graduated from a medical school here, who did a medical school here, but it's a foreign. Maybe the third one may even be someone who is a child of an immigrant, but it's a medical school here. But either way, you need to have some resources, right? Unfortunately, it's not like my time. Now we have social media, we have the internet. And there are there's the Ghana Physicians and Surgeons Foundation for anyone who has graduated as a doctor, and it's a Ghanaian. Okay, so that's for Ghanaians. And then there's also something called, there's a website I found called the f1doctor.com. And that is for foreign doctors, foreign medical students, anyone who wants to be a doctor, who is a doctor, wants a residency. Someone has got that for you. This is a Stanford graduate who's a foreigner or something. So f1doctor.com is also a good resource. I'm saying that when you're plugged into these things, you listen in and you're always finding out more information. You find out stuff like this that I didn't know.
Wow. Okay. Great. We will get a last question. So Clarence, you stressed on relationship building, networking, and within the relationship building, knowing people's real names. Nicknames are great, but knowing people's and just getting connected. And I mean, Ahmed zoomed in on seek information, right? Be informed. There are so many resources out there now. Okay, thank you so much. This has been great. Farah, are there any more comments before I go to the last question?
Yes, we have one comment. It's very interesting how similar experiences are across various cultures, disciplines, and industries. Thank you all for sharing.
Thank you. Thank you all so much for sharing. Thank you for joining us today. We have the last question, which will, well, all the questions are based on the book. But what I've asked Anne-Marie and Clarence to do is take one topic or subject from Breaking Through from this book and relate it to your career journey. So there are 9 chapters, and I'll go over the chapters. The first chapter is Don't Abandon Your Culture, Have an Ally, Coach, Mentor, or Champion, Seek Growth Opportunities, Be Confident in Your Own Skin, Navigate Office Politics Skillfully, Take Advantage of Resources, Build Relationships and Network, Develop Negotiating Skills, Stand Out and Shine. Let me quickly plug in that one of the topics, all the series, the conversations we've had, we have not yet touched on navigating office politics, and it's coming soon. So these are the 9 chapters within the book. I want you to take any one of them that you can speak to regarding your career, your journey. And let me also add that you can follow Clarence and Anne-Marie on LinkedIn. And if you have additional questions, by all means, you can reach out to them. But thank you again for coming to this today's conversation. And I will ask this time, Annie, I think you can go. Anne-Marie, Anne-Marie, I think you'll go first. And then you can add any parting words of wisdom.
Okay, so maybe this is a blend of seek growth opportunities and take advantage of resources, but I'll just say that like Clarence made a comment earlier on that, you make a decision somewhere along the line. Our training is long. You've done all these years of medical school and then you do these years of residency and then maybe you do a fellowship. So you decide somewhere when enough is enough. You also want to have a balance. So seeking growth opportunities for me, it's just because I've signed on to this job and I have to do it. And for the reasons that you look at the patients you're taking care of and you have to have the knowledge base. So it's not growth or it's not taking advantage of, it's like what you need to do the job. And our job is such that the knowledge changes so quickly, and as more research is done, things change. And I have found that out as I've gone along. But one reason why I crash landed into it in that I was 1 year into the job as an attending at the university when we had an unfortunate situation where the chief of ultrasound section passed away. And we were like a family as faculty. So they asked me to do it. And it wasn't because I wanted to do it because I didn't want one more thing on my plate. But I realized that in that setting, it was in poor taste to say I wouldn't do it. So I did it, but I realized that because of that, I took on all the ultrasound lectures and I was giving the whole syllabus. I was giving it for the board exam. And I realized that the more I did, I realized that this is the one thing that is making me read, because with my family life and everything, I couldn't have sat down to keep up with everything, but this kept me current. And so I learned that from the get-go. And now, although I've left academia, is the reason why I still give lectures. Because every time I give a lecture, I learn something new. And it's amazing how things change. The things that you were teaching, the things that you were using to practice, how you follow up a patient, how often, when you stop following up, changes so much. That I just gave a lecture last week and I realized that some things I didn't know had changed since last year. So this is an example to say that because of that, I'm glad that I'm seeking those growth opportunities, not growth in that I don't want to get into politics of being a radiologist, but just growth in knowledge and taking advantage of whatever resources I have. So whenever someone says, give a lecture, I want to do it because I'm going to read again. So that's what I would say about that.
Great. Okay, Clarence.
Okay. Man is probably going to get on my case for saying this, but I just want to put in a plug for the book, please. It's a small book. It's inexpensive. Buy one. Don't borrow your friends. Just buy one. And when you buy one, buy an extra one for somebody else. It's a short book. You can finish it in 2 afternoons, 1 weekend, or 1 long flight. You're going to fly somewhere. You're going to sit on the beach somewhere. You can finish the book, please. It's a really good book. I've learned a lot from it. I'm 60 years old and I'm still learning. So if you are younger than me, I'm sure there's much more you can learn. Quickly about one other thing, I think about building relationships. So we think about building relationships at work. You want to do that through work and so on. But some of the strongest relationships and even the ones that come back to help in work are actually formed outside the workplace. I have learned lately over time, the relationships you form at church, for example, and I don't go to a Ghanaian church, partly for that reason. You go to when you move to a place, you go to the institutions that they have, or you have a hobby. Maybe you like soccer. Well, go join a soccer club or go coach a soccer club. Get to meet some of those parents, some of those kids. Maybe you like photography. Don't just do it on your own. Join a photography club because you'll meet people there. People there will meet you. Some of that will come back to help at work or otherwise, enrich your life that way. I think that helps a lot. Going back just one more step to what decisions I might have made that made the most difference. I think it's very important early in one's career, at least in my type of work, you need to decide whether you're going to spend the rest of your time in this country or whether you are here as a visitor. Because it makes a big difference. Where do you save your money? Where do you invest your time? Where do you plan your time? Are you going to go? I mean, I lost some time because very early in my career, I had come here with the intent to just gain a postgraduate education and go back to Ghana. Over the years, it ended up differently and I've stayed longer. But there are many things I would have done differently if I had decided early on that I was going to stay. So there's a difference between a visitor and somebody who has migrated or sojourned to a place. In my language, we say yetukwai, meaning we travel to a place as a visitor. But there's another word, they say yetu bata, which is when somebody travels to a place with the intent of settling there, living there, being an immigrant there. The way you manage your life is very different between the two. And I think that decision should probably be made very early on.
Wow, that is deep. That is deep. Are you a sojourner? Are you a traveler? Are you a visitor? Or have you come to stay? Wow. We have 5 minutes. If there's no question, Clarence and Annie, let me just ask you, let's just throw this in. Somebody wants to get into the healthcare industry. Let's say I did social sciences. One piece of advice, so I want to change careers. I want to be a nurse now, or just a little bit of, if you can give just briefly. I know it's the healthcare space is really huge, but can you advise on that? And then we'll close.
I would say first, find out what the end result is that you want. And the end result is not only to be a doctor or to be a nurse. I mean, many people, especially, you know, everything, a lot of people, a lot of children will say, I want to be a doctor or I want to be a nurse. Well, there's radiology technicians, there are laboratory technicians, there are medical assistants, there are physician assistants, there are nurse practitioners, there are different types of nurses, different types of doctors. There's academics, there's non-academics, there's visual things where you never touch a patient, and there are things where you are operating on patients and so on. So first, try to find out if you can, what the people do in the field that you want to be. How much do they earn? How much time do they spend? What's their title and so on? And it's not just doctors and nurses. There are probably dozens of other things that you can be in the healthcare field.
Great. I saw a comment pop up from Sheila. Farah, do you want to read that? And then Annie will close us with the answer. Or Sheila, you can unmute yourself if you want to speak. Hi.
Okay.
Hi, good morning, everyone. So I am at Kaiser Permanente. I met Miss Amoa at one of the conferences there. I don't even think she realized I kind of sort of bought my way into that event because I'm not management, but that is what I see. So that was a great question you asked just now. I'm in administration, I'm in clerical, but I do want to advance to leadership. So wanting to know what channels I can do to get there. Also considered moving to Arizona. As you know, the cost of living in California is really high. So considered moving elsewhere. I do know they went up from where they used to be, but it's still not where California is. So I just wanted to know how they help me in getting into leadership and management at any facility. I've looked into Banner Health there. I've looked into the VA, just wanting advice on that. And it can happen after, if possible. If not, then whenever.
Sure. I can. Hi, Sheila. I can connect you to Annie and Clarence after this conference. Thank you for your
Thank you so much.
Thank you. Thank you, everyone, for coming. I'm giving Annie the last word, and then we will close.
So this is regarding how does one get into the healthcare industry? Is that correct?
Yeah, young, old. I want to.
Yeah, I would just say that the first thing I'll say is that it's very possible. This is America, and we in my training, I when I was a resident, someone had just finished residency, and he was over 50 because he had been a dentist, and then he wanted to be a doctor in another country. He wanted to be a doctor. People have come from all walks of life. One of the guys I did my residency with was an engineer. I have a friend who's Kenyan who came here to do her. She did finance, and then she decided to switch to medicine after that. She finished the whole thing, and then she did. So it's possible. Question is how. So find out, again, the information, connect with people, connect with f1doctor.com, connect with people who you know. You can reach out to me, find out how to get there, look up the information. But I'll just tell you that it's very possible. And I think one advantage you have is that you have a more mature mindset because you've done something else and you've been somewhere else. You just didn't come straight out of college and do this. So you have something going for you there, and you can do it. Was that the question?
Yes, yeah. But I think I hear from both of you it's possible. Find out, and Clarence also touched on information. This has been, honestly, Clarence, I blame you for this 1 hour. I feel like we just scratched the surface, but thank you all so much for coming. Thank you, Dr. Anne-Marie. Thank you, Clarence. Thank you so much. Thank you for everyone who is here today. I don't want to get into trouble by mentioning names, but some of you just saw it on Facebook, and here you are for your participation. Really, 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 really grateful. And our journeys, we are all on a journey, and I think we are all learning. And Clarence is saying, okay, pick up the book, Breaking Through. I didn't tell him to say anything, but pick up the book, and happy to connect with you. you can connect with me. Or you can find Clarence and Anne-Marie on LinkedIn and follow up with any questions that you have. And we probably will be having you next time speaking to all of us. But thank you all so much for coming. Really, really grateful. Thank you.
Thank you.
The rest of your.
Thank you.
And thank you very much.
Thanks
I
for having
enjoyed
me.
Thank you very much. I enjoyed it thoroughly.
Same here. Bye-bye.
Thank you, Clarence and Annie, Dr.
Thank
Annie.
you. Bye-bye.
I appreciate you.
Bye.
Bye.
Thank you.
Thank you. Those from Ghana, Canada, Arizona, Maryland. I see Richmond. I see, thank you. Thank you. California.
Bye.